I'd like to call this meeting of the Buncombe County Commission to order. Thank you all for being with us today. This is a meeting that we needed to hold today to cover an item that we had on our agenda for our county commission meeting yesterday evening, which we needed to cancel due to the potential and unfortunately the reality of the severe storm that came through western North Carolina yesterday afternoon and early evening, which resulted in a severe and dangerous flooding throughout parts of Buncombe County and western North Carolina. Before we get started, I just want to express my appreciation to all the members of the Buncombe County Emergency Medical Services and other first responders in Buncombe County and western North Carolina who went out yesterday and this morning and are continuing to work hard to keep people safe and to save people's lives. So thank you. Thank you to all of those men and women. Let's begin our meeting with the Pledge of Allegiance. Please rise and join us in the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Commissioners, the primary purpose of our meeting today is for consideration of a local state of emergency. Before we get to that, since it is focused on the COVID pandemic response issues in Buncombe County, we'd first like to get an update from our Public Health Director, Stacy Saunders, and members of her team.
Good afternoon. A little bit earlier than I usually get to see you all in the day. So today we do have our COVID-19 update for you all. Just make sure that our objectives today are really to update you on the current situation and our current COVID landscape. Also, what has changed since our last update with you all, and then what we are recommending to do right now to reduce the spread. So our current trends, currently we have had 20,346 total cases of COVID-19 in Buncombe County since the pandemic start. And trends have not improved since speaking to you all on August 3rd. We are currently seeing 261 cases per 100,000 per week. This is a six-fold increase from just 1 month ago. And we are now seeing about 89 new cases per day on average in our public health workflow. And this is up from 51 new cases just 2 weeks ago. Our percent positivity is now 8.5%. 2 weeks ago, this was 7.2%. And this is a very stark difference from about a month ago when it was 2.5%. As I mentioned, 2 weeks ago, when I was with you all, this is our epi curve, and the slope of this epi curve is far steeper than our previous curves. And also, as I mentioned previously, this curve is being fueled by a much more contagious Delta variant. The Delta variant is showing its determination, as it has been the predominant strain found in our nation and our state for several weeks now. And this slope shows its greater impact on transmissibility, potentially infecting far many more people than the original strain. The average age of our new cases is currently 38 years old. In the last few weeks, the highest rates of infections have been in those age groups of 18 to 24, 25 to 49-year-olds, and then 50 to 64-year-olds. These age groups, as you're very much aware, make up our workforce, our parents, your children, your neighbors, your family members, even those of us sitting in this room make up that age group and make up a cross-section of that group. These are the age groups that are driving, the driving force for our economy, and now they are driving our infections. The biggest overall trends still remain that we are trending younger in our infections, and then also that overwhelmingly the vast majority of all newly investigated cases are in those who are not fully vaccinated. In terms of hospitalizations, and this is the regional hospitalization data, so as folks may go to different hospitals within the area, we have seen a steady upward trend in the number of individuals hospitalized with COVID-19, and also the burden of COVID-19 in ICU has fluctuated over the last several weeks, but is hovering around 30% right now. The highest proportion of those newly admitted to hospitals for COVID-19 are younger than they were historically about a year ago. Now, the biggest proportion of those being admitted to our hospitals in the last couple of weeks are in their 50s. Very different than about a year ago, and even in our winter surge. And when I get to speak with you all every couple weeks, I always say that much of that is because of our older population. They did their part and got vaccinated at a very high level. One of the best ways to reduce not only new infections, but also hospitalizations and deaths is to get vaccinated. Buncombe County currently has 62% of our total population at least partially vaccinated, and 58% of our total population is fully vaccinated. Looking at the vaccine rates by age, we see our highest rates in those, as I just mentioned, in those who are 65 and older. I do want to note that in the most recent weeks, we are seeing vaccination rate trends increase. If you'll look particularly at the first graph, our older population are those green and that darker blue. That has stayed steady. But if you look at all the other lines, you will see that slight uptick in the last week or so. That is so very encouraging around vaccination uptake. But with our with our 11 years old and younger still not eligible, it's very imperative that the eligible populations, meaning 12 and up, get vaccinated in order to best protect them until they are eligible, and also to help limit the ability of this virus to spread. Higher vaccination rates mean less opportunity for the virus to transmit to other hosts, meaning that we are also limiting its ability to create other variants. We continue to be committed to vaccination as our priority public health tool to stomp down COVID-19. Buncombe County HHS has administered over 97,500 total doses of vaccine so far. We continue to offer vaccines at our fixed site at 40 Cox Avenue, where the health department is located in Asheville, and also continue to support vaccine outreach events throughout the area, including our schools, community centers, and different work sites. Additionally, the FEMA vaccine resource that's been in our area has been quite successful and has provided so far over 300 doses of vaccine in its first 3 weeks of implementation. As mentioned 2 weeks ago, we were invited by North Carolina DHHS to participate and offer the incentive cards via the summer incentive program that the Department of Health and Human Services is sponsoring. We actually saw a twofold increase in vaccination administration in the 2 weeks during we've had the incentive program as compared to the 2 weeks prior. So that's very encouraging. We do believe that the increase in the amount of the incentive cards from $25 to $100 for those who are receiving their first dose did drive the popularity and did drive that increase. As a reminder for folks who are listening in, those who are 18 and up receiving their first dose of vaccine are eligible for $100. Those 18 and up that drive an individual receiving their first dose to a vaccine site are eligible for a $25 incentive card. And just a reminder for folks that this program is expected to end at the end of August, and we've not heard any plans to extend it further than that.
Stacy, sorry to interrupt you. Am I correct in saying we're not out of $100 gift cards?
We are not.
We're still,
No,
okay, cool.
our shipment this week should arrive today or tomorrow, but for the popularity of the program, the week that they DHHS increased it to $100, vaccine providers did run out, and so it was while supplies last. DHHS actually put in a contingency so that it is still, while supplies last, we can give you a physical card. And if we run out of physical cards, we do have an option to do a digital card. And so that way, if we physically run out of that supply, then we still have an option to provide that for folks, just in a different way. I did want to mention what has changed since the last time that I met with you all. And Buncombe County Public Health has begun implementing the recent recommendation from the CDC to provide a third additional dose for those who are moderately or severely immunocompromised. Those who received Moderna or Pfizer and are moderately or severely immunocompromised can receive an additional dose of vaccine. And this is in order to better protect themselves, given that their immune system is compromised or suppressed. The current CDC recommendation for the additional dose for immunocompromised or immunosuppressed individuals include those who have been receiving active cancer treatments for tumors or cancers of the blood, received an organ transplant and are taking medications to suppress the immune system, received a stem cell transplant within the last 2 years, or are taking medications to suppress the immune system, moderate or severe primary immunodeficiency, advanced or untreated HIV infection, and active treatment with high-dose corticosteroids or other drugs that may suppress one's immune system. So individuals must self-attest that they qualify for the third additional dose by having a condition or taking medication that is listed in the criteria that would cause them to be moderately or severely immunocompromised. So Buncombe County Public Health has been administering those third additional doses to those specific populations at our walk-in clinic at 40 Cox, where the health department is located, and also at our mobile outreach events. Just a reminder, though, for folks that additional third doses for those who are moderately or severely immunocompromised can be secured at any vaccine provider, and the individual does not have to go back to their original vaccine provider if they need to reach out to another vaccine provider. This recommendation does not include individuals who received the J&J vaccine at this time. There is no further recommendation for third doses or boosters for other individuals at this time, but you're likely aware of the news reports that is likely coming soon. And I will say at this time, we do not have a formal recommendation nor guidance around boosters, but that is developing and evolving very quickly. I do believe, as I was on my way here, we had the president speak about that, and we are likely to hear more in the coming days. So before providing the current public health recommendations, I did want to recap some of our local trends. This metric table looks a bit different than the last time I saw you all. And our incidence rate continues to rise and is consistently in red. Our percent positivity has now increased so much that it is in an orange area. Additionally, our COVID deaths per 100,000 per week is now in orange. Our hospital beds, percent inpatient hospital beds occupied with COVID-19 has now trended high enough to be in the yellow and continues to trend up. And our ICU beds with COVID-19, while still favorable on this table, I will tell you that the trend line is pretty steep and is increasing and has seen about a 13% increase in just the last week. So with that, I'm coming to you today, and Public Health is recommending the following actions that we need to take now. Implement a county-wide face covering requirement for all indoor public spaces while we are in substantial or high transmission. And also, Public Health recommending that all indoor public spaces implement social distancing requirement or social distancing measures, to further reduce the spread. So I want to just go back to this epi curve, just to leave you with that image of that steeper slope and say that we do have the power now to change this curve. And putting our face covering requirement in place now has the potential to help us push down transmission to a lower and more manageable and more controlled level, especially coupled with our continuation to increase our vaccination rates, vaccination and masking. These two actions can help us take control of COVID-19 and its Delta variant. And these two actions can help us reduce the spread of infection and in turn reduce hospitalizations and then the poorest of all outcomes, deaths. And as I wrap up today, I just want to say that the overwhelming majority of new cases, hospitalizations, and deaths in our state are in those who are not fully vaccinated. And please, if you have not gotten your vaccination, please consider doing so today. There is a vaccine waiting for you at our location or at one of our vaccine partners within our county and region. And if you are vaccinated, I want you to become a public health champion with us and a warrior and have friends and families that are not yet vaccinated. Please consider encouraging them to get vaccinated. I'm pretty sure I said it the last time I was here, but you are far more influential and you may be the voice that they listen to. You may be the reason that they stay healthy and out of the hospital. I did want to have just a couple of reminders as I close out. Remember, if you receive a positive COVID test, isolate right away. Don't wait. If you get your positive result or if you are symptomatic and are getting tested and not gotten your test yet, go isolate. And this means go home and limit your interactions with those, even with those who are in your family. This does not mean go to work. This does not mean go to school or other community events. Please isolate so that you can stop the spread of infection. And if you are having symptoms consistent with COVID-19 or think you might be exposed, please get tested. So now is the time to vax up and mask up. We have let COVID-19 and its Delta variant control too much, and now we have to take control back. We can do that through vaccine and requiring face coverings in all indoor spaces, especially now in this time of high
Excuse me, please refrain from commenting when other people are speaking. We will take public comment in a little while, so everyone will have a chance to speak who's here. But when other people are speaking, I ask that you please be quiet.
So please vax up and mask up so that we can all help in decreasing the number of infections. And as I said, that in turn helps us decrease hospitalizations and deaths. So please, we can do this. You can do this. We can do this. And I appreciate your time today.
Thank you, Stacy. Commissioners, are there any questions?
Just had a couple quick questions. Thank you so much, Stacy, to you and all your colleagues who I know are, have been on the front lines of this for a long time and are redoubling efforts now. One quick point, which is just that it's encouraging to hear that there's been that uptick in vaccinations with the rollout of the incentives, and I'm excited to hear that. That seems like an optimistic note for sure. I did have just two quick questions related to pediatric cases. One is if you could just share the latest sort of projected timeline around when the vaccine might be available for those 12 and under.
Sure. So no firm timeline yet, but we do anticipate it fall. Maybe if the timeline keeps, then sometime in the fall. If anything gets delayed, then other things we've heard is early winter. So that would be our 11-year-olds and younger.
Great.
So,
Okay, thanks. And then just as we're looking at the epi curve by age, it looks like what we're seeing in that population of young children is numbers that are sort of comparable to what we saw last winter at the peak of things. Are you seeing anything at the level of hospitalizations among children that is raising concerns or that we should be aware of?
not at this time. So the
Good news.
hospitalizations for pediatrics is still fairly low. I will remind everyone that hospitalizations are one of those lagging indicators, which means you first see the cases, then folks have to get pretty sick, and then you see them in the hospital, right? At this point, the hospitalization data is still consistent with what we've seen in the past. The new cases for those younger than 17 is typically we've seen somewhere around 10 to 11%. We were just at 12% this last time. So that's one that I'll be watching just to see, particularly as we have kids. Our kiddos are going to be going back to school soon. So
Okay,
that's
great.
one to
And
watch.
thank you. Just one more other question is, as we think about folks in our community who are not yet vaccinated, do we have any estimates of what percentage of those folks might have a medical condition that would indicate they should not get vaccinated? Or is that sort of a hard number to pin down?
That's a great question, and I do not and have not seen data on that.
Okay.
I'll see if we can get some of that for you, at least something we can extrapolate either from a national or a state perspective, but most certainly locally, I've not seen any of that.
I think the more that we can really understand and sort of understand the cohorts that exist within the unvaccinated population, so for instance, children under 11 who can't yet get vaccinated, folks who have medical conditions that contraindicate it, folks who maybe are experiencing challenges around accessing it, and then folks who are choosing not to. It would just be helpful as we think about the strategies and interventions we might need to roll out in the months ahead, and being as nuanced and sort of targeted as we can about really addressing the challenges that different communities are facing. That would be great. Thank you.
Thanks so much.
Stacey, I had a couple of questions. On the slide regarding the $100 gift cards, I think I heard you correctly. You're suggesting that the great uptick we're seeing in vaccinations is due to that program. Is that what you're?
Partly,
attributing
yes. So as we saw, as soon as we implemented the incentive cards, well, I will say a couple of things happened at the same time, right? So we came into the program, and the day of us coming, or the day right before us coming into the program, they switched from $25 to $100. And so across the state, prior to us being involved in it, the $25 incentive program had some modest returns. We saw statewide that when it switched to $100, that lots more folks came out. That was sort of a threshold, I think, that really sort of drove and sort of made a motivation for folks. And so as folks were coming into our fixed site, definitely hearing, yep, I heard there was a $100 gift card, and I'm here to get my shot. And the other anecdotal trend we saw again was that folks had thought that in that decline that we saw, that maybe they were going to be okay, but when they started seeing things go up again in the Delta variant, more news about the Delta variant was swaying them to come in now, that maybe they really did need to come and get their vaccine. And then the third thing we heard from folks is that someone that cares about them or loves them told them that it was time. Like things were getting serious again, it was time for them to get vaccinated. They didn't need to wait anymore.
Great. And then just two others. I wanted to ask about testing. Just hear anecdotal stories about access to testing and wait times and that sort of thing. And I didn't know if there was still public, government-led testing efforts going on in our community at all.
Yes, thank you for that question. So we actually transitioned much of our testing over to a state vendor when vaccination operations began. because we were using the same resources for testing as we were going to be using for vaccine, and those were already pretty limited. And so we do still have, so Buncombe County Public Health partners with StarMed, which is a state testing vendor, the state of Department of Health and Human Services vendor, to do community testing that we were doing. And I will tell you, the weekly numbers for testing have increased significantly in the last week. I think about, and I'll just say roughly 3-4 maybe weeks ago, we were seeing those weekly testing numbers be around 600 or so. As for last week, the weekly testing number, and that's not just that is more than what Public Health would do or StarMed would do. It means anybody within the Buncombe County space. It was about 2,300. So
Okay.
almost a 4 times increase in that time. And so if folks are interested in COVID testing, you can still look for a testing provider using the North Carolina Department of Health and Human Services website, Find My Testing Place. And there I would recommend options 1 and 2. Option 1 is where you can find a community event, sort of like at a church or at what we used to do at AB Tech. And then the second option are more fixed site, continually sort of Monday through Friday types of testing providers. And that's where you'll find your CVS's, your Walgreens, and some of your urgent cares.
Okay. And the last question, in the past, you've talked to us about the creative, vaccine outreach efforts you've had at businesses and at schools and that sort of thing. Is that kind of thing still ongoing, and what can you?
Yes, I didn't want to
Also,
overwhelm you with too much on a slide.
Yeah.
Yes, that is. And so we still have our outreach out in the community. And I wrote it down because I thought maybe you might ask. And so the outreach for this coming week, we have this week at a recreational site, the Supper Club. We're partnering with those folks again. And then for the rest of the month, we've got 2 work sites, we've got a faith-based, and we've got some other community events popping up. So absolutely, still working with employers, still working with our faith-based community, our community centers, recreation and leisure, trying to really sort of get folks where they are. I will say our FEMA partner, they are back in Haywood County this week. I believe. Yep, they are back in Haywood County this week, and the storms from yesterday have delayed them a little bit today, but hopeful that they'll be able to continue their work later this week. And they even have some outreach planned for Brevard College this week and Haywood Community College, in addition to the fixed site that they do in Haywood County. So we've been alternating back and forth, and that's been quite successful.
Stacy, thank you so much for your presentation and updated information. I'm curious if you have any idea now of the timeline that the vaccine will receive full FDA approval. And do you think there will be an uptick in folks looking to receive the vaccination once it is no longer an emergency authorized use?
Thanks for that question. I wish I had a firm timeline for that too. It's more just sort of estimates that we anticipate that. We've been hearing that may be as soon as September-ish. While I don't have hard data on it, I do know anecdotally, I've had folks say, and even when I'm out in community, say, I'm waiting for that approval. And so I do anticipate that we are likely to see maybe a small number of folks coming in when that receives its full approval. I just want to reiterate to folks, though, that the vaccine is safe, it's effective, it's gone through the same process, and the research, the methodology in which the vaccines are built upon is a process that we've used for many, many years.
No commenting or feedback on people who are speaking. When you get a chance to speak, I will make sure that you have a chance to speak without being interrupted, and I'm going to insist that you also provide that to the other people who are speaking. Thank you.
So the science is not new. So.
Thank you for that reminder.
Yeah.
And again, thanks for all that you're doing.
Stacy, I have a question. And, in a few minutes, we're going to take up consideration of the updated local health emergency policy and the associated indoor mask requirement. So obviously, this is an issue that there's a degree of controversy on in the community. There are people, we've all heard from hundreds of people in the last few days many of whom support it, but some who do not. And I guess, would it be possible for you as the Buncombe County Public Health Director to just, summarize your perspective about why you believe that is an important and effective public health measure to take? There are, I think, a lot of people in the community who genuinely believe that the science doesn't support that wearing masks has a beneficial impact on this public health challenge that we're facing. So I'd just like to ask you to just kind of comment on that directly.
Well, thanks for that. And I will just say, can only speak from the public health perspective, which is Public Health 101 and infection prevention. When and if able, one of our best prevention tools is vaccination. So if you haven't done that, please do that. We have an emerging and a novel virus among us, and that we are learning about it. And as it has continued to change, its strength has changed, its in transmissibility has changed, which then, I think we were all hopeful, vaccine, and that is still so true. But we have allowed the virus to change at this point, which then creates a new vulnerability. And in this time of high and substantial or high transmission, it's really important that it's not an or anymore, it's an and those things are additive. So again, as I said, like vaccine, because we have tackled communicable disease for decades with finding effective vaccine. This is no different. This is, the same type of process and ideology that we had many moons ago when we looked for vaccine for measles and found a safe and effective one and began to protect our children and our population in that way. What we are dealing with now is a time of high transmission where we also have a variant that right now is far more contagious, but not more deadly. And so what we have to do now is stomp down these infection rates, because every time someone gets, and I mean that, every time someone gets infected, and think about that on a global level, that is an opportunity for that virus to change itself. I don't want us to be in a place where we have a variant that is more contagious and more deadly. So we have to do things now to make sure that we reduce that risk and reduce that transmission so that we can protect folks. That means that we continue our efforts with vaccination, and during this time of substantial and high transmissibility, that we have to mask up so that we can protect our community. That's what that means, and that these are public health interventions that have been around for a very long time, and before even vaccination was a tool in our tool belt. We were using the wear your face covering, keep apart, distance means something, stopping those respiratory droplets from coming out of your mouth or stopping them from coming out of someone else's. These are things that help us reduce the spread. And as always, please continue to wash your hands. That's one for every day. Make sure you wash your hands, right? So I hope that answered your question. It's now is a critical time. I want that epi curve to be pushed down. We've worked really hard, and all of us in this community have worked really hard, and we're faced, COVID has given us many challenges, and this is one of them, but I think this is the community that can rise to that and say, yep, it's an and we need to do that right now so that we can protect our community and get through this.
All right, thank you. Commissioners, are there any other questions at this time?
Yes. Stacy, you mentioned that 58% of the people's been fully vaccinated now.
Yes, sir.
August 3rd, we was at 58 is what I have also.
Yes.
So how many during this August 1st to August 31st has you said we've run out of the cards, but have you got a number of how many people?
I can tell you how many we did, because we are the only provider who's got the incentive cards right now. And so between that 2-week period before, we were doing less than 200 a week. This past week, we did well over 400, just in that one short period of time of like the 2 weeks prior versus the week that we implemented.
So since August 3rd, I think I'm understanding 600?
Since August 3rd, that would be, we did about 300 and some during that 2 weeks. And then this past 2 weeks, it was over 700 with the 2 weeks combined. So about 1,000 over the course of the 4 weeks.
Over the 4, yes, that's before the August 1st, so of when the $100
That's right.
was given.
Yep. Sorry,
And-
my mind is in 4-week chunks. Sorry. Yes.
Okay. And also, I know today's going to be a lot of concern here. And one thing is, I think you answered most of the mass what Chairman Newman was asking. But the thing, the ones that's been vaccinated, and it seems like this year, I know a lot more people that have had the COVID or Delta variant than last year. It was like last year, it was people I didn't really know. But I know a lot of them, and I mean, we're talking 260,000 here, nowhere near them number. I'm talking about 25, 30 that have had the vaccine and have got this Delta virus and have been really sick. So, and I know that there's nothing there, but could you just talk a little bit about that right there? There's people that's had the virus.
Sure.
There's people that didn't have the vaccine that are very sick, but there's people that had it that are very sick too.
Thanks for the question. And I think I mentioned last time when I spoke to you all that, no vaccine is 100%. None of them that we have out in the world are 100%. And neither are the ones that we have for COVID-19. Originally they showed extremely high effectiveness, like well over, I think it was, 92, 95% in that range, right? That even at the very beginning when we had vaccine administration and we had those very high levels of effectiveness, we still expected to have folks who would have a post-vaccination infection. That's going to happen. Now, with new variants, and particularly with the Delta, what we did see is that it doesn't completely evade the vaccine, but it does sort of reduce it. It is a bit more savvy than the original strain, right? And so we saw a reduction in effectiveness against Delta to the tune of anywhere around like average like 10, 15%. So that took us down into sort of the 70s, maybe 80% effective. So still really effective, but that percentage of post-vaccination infections is going to increase because we've got a variant that's a bit savvier, bit more clever, has changed itself, and makes that vaccination not quite as high as it was before, but still really effective when we think about the big scheme of things. That's pretty good protection. And so the idea that we wouldn't see any post-vaccination infections is just that's not reality. We will see them, and so you are likely to be hearing from folks. Overall, I will say, I know that as folks are in their communities and in their little networks, that you are likely to hear about it. I just wanted to sort of zoom that out a little bit and say, in the big scheme of things, in the state, in the nation, that what we see is overwhelmingly those with vaccine, that if you are to get infected, typically your symptoms are going to be less. You're less likely to end up in the hospital. I believe Dr. Hathaway might have mentioned that last time, that, to the tune of maybe eightfold of reduction in being in the hospital. Same for death. So this isn't just about, it's so important that the vaccine prevents overwhelmingly infections, but even more so if we were to see a post-vaccination infection, overwhelmingly it's also going to keep you out of the hospital and keep you from being in the ground. And that's what we are, that's part of all of this that sometimes I think we lose, is that no vaccine is perfect, but they're pretty good. And if you were to be one of those people who gets a post-vaccination infection, it's less likely that you're going to have severe illness, far less likely that you're going to be hospitalized, and far less likely that we're going to be burying you.
All right, Commissioners, are there any other questions at this time? For Stacy, I'll address public comment in just a moment. So Stacy, thank you. Michael Frew, are you up next to talk about before you do that, I just want to have one process question, which I guess is for Mr. Frew. Commissioner Sloan has an obligation that he's going to have to leave at 1 o'clock for. So if there's a motion made and voted on after Commissioner Sloan has to leave, is he recorded? If you're at the beginning of the meeting, if you're here, but then you have to leave, if you depart, is your vote simply not recorded, or are you recorded as a yes vote? I forget what the procedure is.
The law generally speaks to a board member getting up and leaving without consent of the remainder of the board, in which case that board member's vote is registered as yes. And in this situation, we're sort of splitting hairs, and I would just suggest that Commissioner Sloan let the clerk know how he feels about it, and that would be part of the minutes.
Okay, but if he does, so he can obviously speak for himself in a moment, kind of say how he feels about it, since he's going to have to depart. But if there is a motion made to approve the proposed local state of emergency and the associated policies, then he would be recorded as an affirmative.
I would say so, yes, sir. I mean, especially in this case. I mean, this is a meeting of the board. It's a regular meeting. This is not a public hearing. It is open to the public. There's no requirement for public comment, so the board has a lot of discretion as to how it wants to handle the motions and procedures.
I just wanted to make sure. That was my understanding, but it doesn't come up that often, so I just wanted to make sure.
Yes, sir.
All right, and we will make sure, so let me say a couple things about public comment. We're going to take public comment on this proposal. And I know there's a lot of folks here in the chambers. There's also folks in the overflow space. And I understand that this is an issue that people have very strong feelings about within our community on all sides of the issue. But part of our job is to listen to the community. And so everyone will have a chance to speak today. As I mentioned earlier, I want to make sure when each person speaks, they have a chance to address the commission uninterrupted. So if you hear, and I promise you, you will hear ideas today that you are not going to agree with. Some people might strongly support this, some people might strongly oppose it. But I ask you to not interrupt the people who are speaking, even if you strongly disagree with what they're saying. And I also want to ask that people not clap or cheer or boo or otherwise verbally comment on the people who are speaking. I want everyone to feel like they can come here and address their elected officials and to be respected while they are having the chance to do that. And if you don't do that, you will be asked to leave the meeting. So, Commissioners, one question I did just want to ask the board before we get started on this next piece. Typically, we allow 3 minutes for public comment and up to an hour. There are a lot of folks here today. In some cases, we have reduced the public comment down to 2 minutes to make sure we can kind of hear from everyone. So I don't really have strong feelings about this, but before we move into that, I just wanted to kind of ask the board whether we want to maybe do 2 minutes instead of 3, but then not have a cap on the amount of time that we take so that we can assure everyone who's come out today that we will listen to every person we'll have time to listen to every person who's here, who wants to speak.
I would support doing that. I should add, I have to leave at 2:15 in order to pick up one of my children.
Okay. All right. Does anyone disagree with that, have strong feelings about not doing that?
I think that's a good suggestion, and if we do reach 2:15, I'll probably be back in the meeting, so.
Okay, all right. Okay. All right, well, let's plan on that.
What do we plan on?
So the plan is that we won't limit the amount of time we take public comment, so however long that takes.
3
we'll take
minutes.
it, But we'll give folks 2
2
minutes of
minutes.
comment instead of 3. Are
Okay.
you?
Yes, and I guess I need to speak that myself and Al have a very important board meeting at 2 o'clock also.
Oh, that's
I
right,
want to
yes.
be present, that I can be in on the voting, and hear public comment too. So when are we going to do?
That's at 2 o'clock?
2
Yes,
o'clock?
MSD,
Okay.
yeah.
And Parker, but you have to depart at 1 o'clock.
Yeah.
Okay. Well,
45 minutes.
okay.
And Commissioner, we also have a media Q&A, and staff is going to be leaving. My public health staff will be leaving for that at 2 o'clock as well.
Well, okay, then do the commissioners want to make sure that we carry out this vote before 2 o'clock?
Right.
So around 1:45, we may have to stop public comment to make sure that we can vote while we have a quorum and all the commissioners here who can be here. Are we in agreement
That's
on that?
fine.
All right, well, then I think it's all the more important to take 2 minutes instead of 3 so we can hear from as many folks as possible. All right, Mr. Frew.
Yes, sir, Mr. Chairman, Commissioners, for your consideration is a proposal at the direction of public health officials, CDC, North Carolina Department of Public Health, and our local public health officials, that this board consider a declaration of local state of emergency in Buncombe County alignment with governor's executive orders and requirements for face coverings in public spaces. As our health director said, based on substantial and high transmission rates locally, it is the recommendation that this board reactivate a local state of emergency. Just for your recollection, the numbers were down, the trends were down in the middle of June, and the board, with the consent of other municipalities, withdrew the COVID-19 state of emergency at that time. This resolution, if adopted or declaration, would reinstate that order, and this order would reinstate or align Buncombe County and as well as the city of Asheville, town of Montreat, town of Woodfin, and the town of Weaverville with the governor's executive orders, except for that portion of the executive order that speaks just the governor's staff. And that was strictly to them, and that's not going to be handled with this. There's no requirements in this order for mandatory vaccinations. Pursuant to the executive order, there's specific authority locally to require restrictions that are at a greater level than the executive order. A local mask mandate would meet such a requirement, and it is the recommendation that face coverings be required of all citizens, residents, and visitors in any and all indoor spaces and public spaces to maximize protection from COVID-19 and this variant. What an indoor space means is exactly what it sounds like. That'd be business establishments, offices, and workplaces, including public transportation facilities and vehicles. It would include restaurants and bars, except for an individual or guest would be actively eating or drinking. This order does not apply in situations where individuals are alone in an office or other similar work environment, in the home, or in outdoor settings where social distancing can be achieved. It applies to children 5 years of age and older per CDC guidance. Per CDC guidance as well, under no circumstances is there any recommendation to require face coverings for any child 2 years or younger. This order may not apply and does not apply to face covering exemptions set forth in the Executive Order 209, where medical or developmental conditions prohibit such use. All operators and owners of indoor settings are required to adopt all recommendations in their facilities as provided by CDC and public health facilities. Worship, religion, spiritual gatherings, funeral ceremonies, weddings, and other activities associated with First Amendment rights are exempt from all requirements of this order. It's a reminder that wearing a proper face covering does not replace social distancing. This, as currently drafted, this order would remain in place until September 30th, 2021. Bearing in mind it might have to be revisited based on the health director's recommendations that it remain in place while substantial high transmission rates remain in effect. Again, this would be valid in the town, in the county of Buncombe, including municipalities, City of Asheville, Montreat, Woodfin, and Weaverville. And if you have any questions, I'll be glad to try to answer them.
At this time, I want to make one comment. On our commission agenda last night, we were scheduled to get an update from the county staff about the county's internal policy that county employees either need to be vaccinated or to be tested weekly. So I just wanted to clarify that is an administrative policy, HR policy that the county manager and her staff have adopted. It is not a policy that requires the approval of the county commission. So that's not a policy matter that the county commission would have voted on last night, nor will we be voting on it today. It was more of an update from the staff about the policy. The policy that we will be voting on today is regarding the public health policies that Michael Frew just outlined for the larger community. Okay, commissioners, are there any initial comments? And I'd invite Commissioner Sloan and Beach Ferrara, if you want to make any comments in particular, since you have other obligations that you're going to have to attend to, may or may not be here for the final vote. If there's anything you'd like to say now, and then we will open it up to public comment.
Just that I'm very much in supportive of reinstating a state of emergency and implementing the recommendations of our public health department as soon as possible.
Okay.
I'll be back in about half an hour.
I also support us taking this step and continuing to be vigilant and proactive about implementing public health recommendations as we move forward, and truly believe that our community can come through this difficult period protecting each other's health and staying safe and keeping our economy open and doing everything we can to put our shoulder to the wheel to get on the other side of this. So I'll plan to vote in favor of this. And Commissioners Whitesides and Presley.
We're 2 o'clock.
They're at 2, so I think we're going to be
I'm
pretty.
2:15.
Oh, you're 2:15. Okay,
Yeah.
we'll vote.
Yeah,
Okay,
okay.
okay. I couldn't.
Said my
I'm
piece
sorry.
anyway.
All right.
Spoiler alert.
Okay. All right. Are there any other commissioners who would like to make any initial comments prior to us taking up public comment? Okay. I would just like to make one comment before we open it up to public comment, which is that I appreciate everyone coming out today and people who've called and emailed. You know, obviously this is an issue of strong public interest. This has been a tough time for all of us, for our community. These are hard issues. These kinds of the matters that we're considering today are the kind of proposals that none of us want to be putting in place. Nobody. This is not fun for anyone. But I just want to say I appreciate everyone taking time to share your perspective on this, regardless of where you stand on it. And I would also just say for myself that this is not an issue that I take lightly. I do not think that local government consideration of these kinds of requirements is something that is not a big deal. I think it is a big deal. I think it affects people's lives in ways large and small. And they are the kind of policies that under normal circumstances, I certainly don't think would be the kinds of policies that would be appropriate for local government or any level of government to undertake. But we are in a very unique public health crisis. And for those reasons, I think these are the kinds of ideas that we do have to consider because protecting public health is a big part of our job. But it's the kind of thing that I hope if we do adopt it, I do not see it as a long-term policy. It's something that I think we may need to do now, but I would hope that we would not have to have a requirement as such in the near future. And I think, as was talked about, the efforts around vaccination and other public health policies are really the primary strategies that can help us get to a better place. But it's a policy that I think does need to be considered at this time. So thank you for being here. We have a sign-in sheet. I'm going to
I have just would like to make a comment.
Sure.
That this is a very tough deal we're doing today. And what I'm so proud of is so many people have stepped up on both sides that this shows, I mean, the emails we've got have been unreal. And it ain't been one-sided this time. So there's a lot of concern here from both sides, and we have to make decisions on that. Some people is going to be happy, some's going to be upset. There has never been a decision made here that everyone was happy when it's been like this. But what I'm proud of is we're getting the emails today, yesterday, and Sunday that was in their own words and not paste and copy stuff that I do not enjoy listening to. So what I'm asking is, we're, as commissioners, are here to listen. We cannot voice our opinion back on anyone's comment. And what I'm asking is everyone just do it professional, because your voice is going to count, and we are going to listen today. Thank you.
All right. Again, we're going to have each folks are going to have 2 minutes to speak. You're going to get an orange light when you've got 30 seconds left, and you'll get a red light when your time's up. When your time is up, I ask that you do discontinue public comment at that time, so we will make sure we give everyone the same amount of time to speak. The first speaker, I'm going to mention several people in a row so you can kind of be aware of who's coming up next. The first speaker will be Thomas Kirchgasser. I'm sorry if I'm mispronouncing your name. Followed by Jamie Nix and Kay Olson. And some of them might be in the other room or, okay, great. Thomas, are you, come on up. And so folks will speak at the podium. Okay. And I know I've said your name, but if you don't mind just repeating your name, make sure we get it in the
Sure,
minutes.
it's Tom Kirkgasser. Thanks for the opportunity to comment. I just, I think, your point about listening, I think is important, but it's also interesting that some folks have already committed to a position heading into this, and I think that's a bit confusing, if you will. I think the imposition of emergency is, I think, a very high bar. And from my perspective, I think that, previously we masked up because we're waiting for a vaccine. You say get vaccinated, people got vaccinated. Now I think the scientific question is, should vaccinated people have to mask? And I don't think that's been addressed in the comments here today. So I just wanted to touch on that. I think that if you decide to put an emergency declaration into place, I think using some kind of a metric that makes clear that it ends at some point would be, I think, transparent, clear, and I think reassuring to people if you decide to go in that direction. And then last but not least, I think it's important for the commissioners to set a good example. And I did want to note that one of the commissioners today is wearing a mask that's not in compliance with CDC guidelines. And I think that is just, it sends the wrong message. It feels as if it's kind of pronouncements made, guidelines not being followed. Thank you very much.
Thank you. Thank you, Tom. Next up is Jamie Nix.
I prepared something. The people of this county have heard the same news reports you have access to the same information, and it is clear by taking a look around this county that when given a choice, the vast majority of people don't fear the air they breathe and don't feel the need to don a mask to survive. Despite any mandate imposed on the public by the 7 individuals that sit in front of this room, people's judgment and personal positions won't change. You'll just be masking their personal stance on the matter. August 13th, the Department of Homeland Security released a terrorism bulletin implying that those who question, resist, or disobey government COVID-19 restrictions or question vaccine effectiveness could be or are already being treated as domestic terrorist threat. This is no doubt an attempt to intimidate and silence community members who question the policies of federal agencies and local government. If questions are discouraged, it's not science, it's propaganda. Today in Australia, generally thought of as a democratic society, citizens are in their 8th week of progressively stricter and less humane lockdowns, prisoners in their own homes, and desperate for someone to stop this. The military and police are essentially enforcing martial law with no end in sight. So what's next for us? Every mandate imposed appears to have failed to deliver on its promise and been followed by more oppressive measures. We continue to be told that the situation is worse and that more control is needed. How many booster shots will county employees be required to submit to next month or the month after to retain our livelihood and provide for our families? What assurance do we have at this point that our jobs will not be held as ransom for any number of requirements which violate our physical and spiritual boundaries, as you have already demonstrated? If you continue to follow official recommendations, we already know what is to come because it's the same playbook being used all over the world. We might as well walk off the job now and save ourselves further exposure to experimental medical treatments. If you pass this ordinance, we'll be holding you accountable by insisting that you produce the data that substantiates further oppression of an entire population and demonstrates your confidence that these mask mandates will have any positive impact whatsoever. Does the CARES Act funding tie your hands or influence the autonomy of these types of decisions? If you want to save lives, put more emphasis on prevention and wellness protocols to keep people from getting sick or
Your
going
time
to
is
the
up.
hospital.
Thank you. Please.
A free society
You
works
have
from
to
the
stop
bottom up,
speaking
not
now,
the
or
top
you're,
down.
please
Have the courage to
please
stop
leave
these
now.
authoritarian mandates
Officer,
now.
please escort her out of the room. We're gonna give everyone the same amount of time. I'll let you finish your sentence, but if your speech is longer than you can get in, we won't be able to continue doing public comment if we're not able to maintain the decorum of the space. So I just want to ask everyone to not cheer or boo. Let people speak. We want people to be able to talk to the commission and tell us what you think. But we cannot allow people to interrupt and cheer or boo, and I can't give you more time than other people. So just please, I think these are a reasonable approach to public comment. Okay, this is Kay Olson, and next up is going to be Stephen Arapin and then Paul Benjamin.
My name is Kay Olson, and I'm from Leicester, North Carolina. Just for the record, the 16,000 number that this lady has brought forward is based on a PCR test, and the PCR test has been deemed no good anymore and is being taken off the market. So her 16,000, I'm not sure qualifies as a good number. Now comes the people on Buncombe County, and do hereby state for the record, all government in the Union of the States is by, of, and for the people. The people represented herein are not enemies of the United States. They declare themselves to be beneficiaries of the resultant trust created by the 1776 North Carolina Constitution. They accept the oath of office made pursuant to the aforementioned Constitution or any that followed as evidence of oath takers' fiduciary relationship to the people as beneficiaries. The people represented herein give notice that they claim their estates are not lost at sea or decreased or assumed by the STKV Trust Act of 1666, also passed in Congress in 1933. The government exists and operates at the pleasure of the people. With that said, the people represented herein, a list of which will be provided upon request, openly inform the county commissioners of Buncombe County they do not consent to any form of mask mandate. As several states have already ruled in their Supreme Court, mask mandates are unconstitutional. Further, as fiduciaries of the people, beneficiaries of the Constitutional Trust indenture, those fiduciaries cannot cause harm to the people. A new study has been shown that the impacts on children has caused great damage and a significant buildup of carbon dioxide to these children. Governments may inform, suggest, educate, and play other rules in their duties to the benefit
Okay,
of the
your
people.
time's up. Thank you.
I am serving you with this information.
You may not approach you can give it to the county manager if you want to give us something. All right, thank you so much. All right, Stephen Arapin is next, followed by Paul Benjamin and then Jan Black.
Maybe in the other room?
I think they're,
Chairman Newman.
Yes.
Some individuals may have left because after we told them that they didn't have a mask, they had to go downstairs.
okay, so, and the folks in the other room can hear what's being said here, so that's part of the reason I'm reading out folks' name in advance, so they can kind of be prepared to come in, right? Okay, so I'm assuming Stephen Arapin, Paul Benjamin, and Jan Black may have departed. The next, okay, oh, great, come on up.
Commission, my name is Jan Black. I'm a resident of Buncombe County for the past 24 years. Unlike some who you will hear today, I am pro-vax. I am vaccinated. I recommend that people be vaccinated. I think that is the only way that we will defeat this virus. I do not believe that masks are an effective means of avoiding transmission. And more than that, everyone now has access to the vaccine. If they want to be vaccinated, they've got the opportunity. It's free. Everyone who needs a vaccine now has it. Those who have chosen not to be vaccinated have chosen to run the risk, and it may be a reasonable choice, and it should be a freedom of choice issue. But there is no need to mandate that all those who have been vaccinated continue to mask to protect those who have chosen to expose themselves to the disease. You are imposing a burden on 60% of the population, probably more if you count those who have been infected and who have native immunity. Probably it's more like 75% that you are burdening with these masks to protect those who have chosen not to make themselves immune. I think it's an unwise, probably unconstitutional choice. Thank you.
All right, thank you. The next folks on the list are Gloria Michael.
Chairman Newman, if you mind, do you go back to Steve Irvin? He was downstairs.
Sure.
He's in here now.
Yeah, okay, great, thank you. And the next people who are on the list are Gloria Michael, I think it's Maureen McDonald, okay. And then followed by Dr. Risa Johnson.
Hi. A lot of what's being said is what is properly referred to as unevidenced assertions. There's no evidence that masks work. There's no evidence that the vaccines are safe. The vaccines, even the companies that make them, say that they produce spike proteins in our bodies, and the Salk Institute did a study with just the spike protein and found that the spike protein itself is toxic. And if you look at the VAERS, the Vaccine Adverse Event Reporting System, the government's own system, it shows that I think it's now at 11,000 people have recorded to have died after getting the vaccine, and thousands of injuries. To say that they're safe and effective, it's just like a denial of reality. If you go on the CDC's own website, they're talking about locking people in their rooms, in their houses. This is on the CDC's own website, and they're talking about setting up detention camps. I have studied communism and Nazism, and I've seen how this stuff progresses. And the people who have this mindset that we've seen in history, they don't have friends. They have accomplices, they have collaborators, and they have people who enforce their orders. When we're not useful to them, when our acceptance, our compliance, and our aid is not useful to them, they eliminate us. Look at the Night of Long Knives when Hitler had the SS kill off Ernst Röhm and all his fellow thugs because they were beating up Jews, and he thought it would not look good when people came to watch the Olympics. In communism, there was round after round of assassination of the people who brought communism in. So I'm saying there's no truth, and we've got to stand up to this. I don't mean to be terrifying, have a terrifying message, but we've got to face difficult truths, and we are facing a very difficult time period in the world.
Okay, thank you. Gloria Michael, Maureen McDowell. And then again, the next speakers are Risa Johnson and then Sherry Science.
Thank you. I was a pediatric registered nurse for almost 35 years. In addition to working in hospitals, I organized children's health conferences around the country. Like many of you, I moved to Asheville because it was progressive, open-minded, health-oriented community I had ever encountered. I ask you, what has happened to that open-mindedness? We should all be questioning the ridiculousness of this current fear narrative that is being shoved down our throat, from which you are basing your decisions. The idea that the only answers are to require us to wear masks social distance, and take an experimental toxic injection for a virus that has a 99.97 recovery rate and based on a test that the CDC says now is inaccurate is ludicrous. We have effective treatments for both prevention and early intervention so the virus does not progress. Why is Ms. Stacy over there and all public health agencies not shouting this from the rooftops? I'll tell you why, because if the word gets out that we have effective treatments, then these fear-based strategies of masking, staying away from each other, and forcing people to take an experimental shot are not valid because the Emergency Use Authorization Act would be null and void. And that, my friends, would be when the house of cards fall. Yes, if you are sick, stay home, but asymptomatic people and children are not a threat. So I strongly recommend you seek both sides of this discussion. And masks do not help. They reduce the intake of oxygen, which reduces our immunity. They increase our carbon dioxide level. They cover the dirtiest part of your body when germs are trapped. There is no scientific evidence that supports healthy people should wear these masks. A large group of frontline doctors are suing the government right at this moment to prove there's an emergency, and they can't prove it. Regarding this vaccine, please check the manufacturers. They say it does not prevent transmission, and our own CDC is saying we have over 12,000 deaths happening within a short time of receiving this vaccine. 3,000 of our teenagers now have myocarditis, an inflammation of the heart. Thank you. I ask you to find that open-mindedness that we all
All
came
right,
here
your
for.
time is up. Thank you. All right. And again, could each speaker please just repeat your name just to make sure we're clear on which folks are speaking. Thank you.
My name's Risa Johnson. I'm a chiropractor and I have a diplomate in clinical nutrition. I came here actually just to kind of speak about what I've been seeing in my office, but I just want to make a statement as a public individual, not as a physician to start. Stacy said no vaccine is 100%, but we are being coerced and we're losing our medical choice and freedom. I think, Stacy's presentation had a lot of generalities. I also feel it might be great to have an epidemiologist or a virologist to kind of clarify some of the things, since there's two sides to this story and the interpretation. The incidence is rising, but until we do get to herd immunity, and the population has been out, as you said, since June, we've been free. We've not been masked, we've been out in public. So, the virus is spreading, but the lethalness of the virus has not increased. Also, viruses mutate. That's what happens every year. I mean, this was supposed to be a 2-week, flatten the curve, and right now we're going on to 2 years. My concern is when patients come into the office, and I am a chiropractor, I'm not a medical doctor. I have people coming into the office wanting notes from a medical professional. They say that apparently it doesn't have to be through the medical profession, but they want to protect their children so they don't have to wear masks. Children are becoming claustrophobic. They are having trouble breathing. I said to one little fella, I said, "What do you think about this?" And he said, "Oh, I love it because then I don't have to speak to anybody I don't want to speak to." I think that this has gone on for quite a substantial amount of time, and I think it's really dangerous to our youth.
Thank you. Sorry, your time is up. Next, Sherry Science. Sorry for mispronouncing your name. Yes. And then the next speakers can be Amy Gordon, TJ Martin, and Holly Bittinger.
This is Sherry.
Okay, I'm sorry.
Okay.
Can you stand?
Yeah.
My name is Sherry Science, and up until June, I served as the communications director for a national public health policy nonprofit, and I've been researching COVID daily since February of 2020. From the research that I've done, we're not in a state of emergency, nor do we need to declare one. We keep hearing all of these rumors about how our hospital ICUs are filling up with COVID patients, and it's not true. I personally called Mission and Pardee yesterday. The Mission had a total of 125 COVID patients between its 6 regional hospitals. A third of them were in the ICU, and we don't know, they were not able to tell me what other comorbidities or conditions they had. And by the way, that number is significantly lower than the hospital's peak day, which was January 4th of this year. At Pardee, it's not in Buncombe, it serves people in our community. It has 18 COVID patients, only 3 of whom are in the ICU. Not only are we not in a state of emergency, but our previous emergency measures have been ineffective. Over the past year, we have done exactly what we were told to do. We stayed home, we masked up, we socially distanced, and a large number of people, as you've heard, have gotten their COVID-19 vaccines, some now on a 3rd booster. Yet here we are again, some 18 months later, and you want us to start this cycle all over again. And it is just ridiculous. If you declare a state of emergency and impose these mask mandates, nothing good is what's going to happen. Businesses will once again have to become the mask police. The health department will start policing the businesses. Citizens will be on even higher alert about their health and their safety. And you will create an even bigger environment of fear and hostility in which citizens of Buncombe are afraid for their very lives, and they think that our masking is what's going to keep them alive. This is despite the CDC's own statistics showing that COVID-19 has more than a 99% survivability rate for most people. So in Buncombe, I looked up the numbers. We're done?
Your time's up.
Okay.
Thank you.
I'll send you my comments via email then.
Thank you. All right, Amy Gordon.
Hello, members of the board. My name is Dr. Jessica Petros. Amy was kind enough to give me her spot to talk to you, and I want to come out of love and peace because I think that's the only way we get through this and not division. What I want to talk to you guys about today is how I was a hospitalist for 7 years until finally the system had cracks in it for me. I went down to the cafeteria and saw how they were feeding processed oil and sugar to patients, cancer patients. And back a few years ago, that may sound crazy, but now people think, gosh, we should feed healthy food without pesticides to sick patients. That's called terrain theory. And what I want to talk to you about is terrain versus germ theory, which is what comorbidities fall under, how people who have comorbidities have a higher risk of COVID, right? We have a human microbiome, which billions of bacteria live in. That's our immune system. 80% of our serotonin is made there, which converts over to melatonin. We have a human virome with trillions of viruses. 9% of those viruses make up our DNA, make us who we are in a good way. What singles out a certain germ to make it attack the body? How do we single out and kill a certain germ if they are making us who we are? And that's what I want to put your guys' perspective on to change here as well. And the main points as well as Stacy's data, the chances of getting COVID in Buncombe County are 0.0021 per weekly and 0.00037 per day. When is enough, guys? This is something, how are we intervening in nature by giving 69 vaccines recommended by the CDC before the age of 18? I probably got 14, by the way. What goes into our body matters. It matters how our immune system fights. What do we have clean water? Where are the door-to-door organic food campaigns? Where are the clean water campaigns? That's really what makes people sick. And if we continue down this line with corporations, we will need more vaccines. We will need more mask mandates. We will let the government control our health because we won't take it into our own hands. And we need to look at how germ and terrain theory are both relevant for patients and human health. And that's the truth. I'm a medical doctor, and I've seen this in my own practice. I've successfully treated patients with COVID with ivermectin and hydroxychloroquine. You're seeing one side of the story. I beg you to please research and look between the lines. Thank you.
Lack of scientific support.
This virus.
Yeah.
I pledge allegiance to the flag